as soon as I go to turn, I'm locked out, almost out of neutral, versus that. So right there, take a breath for me. Let it out. Got it. Got it. Let it out. Create space here. Let this head rock. There it was. So now we're here. Still okay? Much better. Okay, so if we go wide and do both at the same time, there we go. So we're getting much closer to being balanced in the hips already.
The accident occurred in February. I'm living in California in Pescadero near the ocean in a farmhouse. There was a little loft bed and it was close to the ceiling, and so I climbed up the ladder and I couldn't really crawl in, so I just kind of had to shimmy into the bed and ended up falling out of the loft bed. And on the way down, the back of my ribs hit a chair. All I remember at that occurrence was a terrible headache, a realization I had broken my neck, and my head was full of lightning and pain radiating through my whole body. And I ended up crying and falling asleep was what happened that night. I woke up in the morning not remembering what happened in the evening because my arms were and my hands were swollen like baseball mitts, and I couldn't raise my hands higher than my waist. The pain was so excruciating in my arms. It felt like both sides were being hit by baseball bats simultaneously and not ending. Intense. What I was feeling was hopelessness, despair, and I didn't want to live. I realized right away I couldn't do what has been keeping me alive, and I've been a sun dancer for 33 years, was the thought that I will no longer be able to sun dance.
What's up, everybody? It's Dr. Brett Jones at the Source Chiropractic here in Tucson, Arizona. And we have an amazing opportunity for a healing immersion with the Sundance brother Bob, coming in a serious way. He needs a lot of help. I look forward to you hearing his story and seeing what's possible. So we're gonna be adjusting him 4 times a day for the next 4 days, so getting about 16 adjustments before we send him off. And we got some good intentions for just increasing functionality, increasing zest for life, to be inspired and to make his way back to the Sundance and back to surfing. So let's get after it. We're gonna start with neck range of motion. So what I want you to do is you're gonna tilt your head down towards your chest.
To where?
To where you start to feel pain or you feel blocked. Okay. About 40 out of 60 degrees in flexion. How about if we go ahead and lean our head backwards? Start to feel pain right there?
Right there.
Okay, so we're about 10 to 15 degrees and he has pain. And where do you feel that pain?
Just right up in here in the upper neck.
Upper neck? Okay. And then go ahead and tilt your head, ear to shoulder.
Crunchy.
Worse to the right.
Pull tight right up in the top of my spine.
Okay. Pain top right. And then when you go to the left, it's a pain top left? Or where's the pain there?
Up in the top right.
Still top right, so mainly top right. Okay, and then how about if you try to rotate? You stay there. Okay. Okay, 30 out of 80. Where do you feel the pull?
Oh, just laterally across from the top to the bottom.
Okay.
Put my shoulder up to the top of my back of my where the little bumps are.
Okay. Top to bottom of cervical spine. And then how about if you turn your neck to the left? A little bit further to the left side, yeah, 40 to 50, okay. And where do you feel that?
Right there, I feel that now, and it radiates down like an X.
Okay. Pain radiates. Okay, I'm gonna go do some upper body muscle tests with it. You can film this, Alex. We're gonna start with the left deltoid, which gets nerve supply from C5, C6. So I'm gonna lift your arm right there's already pain. Okay, so that one we're not gonna do. We're gonna skip that because can't get the arm in the position. We're gonna go ahead and do a bicep curl. So go ahead and curl your arm. Okay, go ahead and do that one again. Curl, Let's say about a 4 out of 5 and you feel pain there. Okay, tricep push down to my hand, push down. That one's pretty strong. Push down again. Yeah, so that one's firing pretty well. Can you go ahead and push out? Okay, so that's turned off as well. I want you to go ahead and push into the back of my fist. Push into the back of my fist, like with your arm. There you go. Push. Okay. I want you to go and try to turn your arm that way. So going down this way. Nothing. So most of the rotator cuff is turned off and you're feeling pain in the deltoid there. Get in position here. Try to push into my hand here. Push in, push up. Okay, done. So that'd be 2 out of 5 on the right delt. Bicep, go ahead and do a bicep curl. Okay, 4. Tricep, push down to my hand here. Push down, there we go, it's 5. Make a fist, bring it back towards your head, hold, flex down, hold, spread fingers wide, hold them wide, I'm gonna try to bring them in. All right, so the reason you can relax, the reason we're doing all of these muscle tests is a lot of the upper body, right, relates to cervical spine. So now you're gonna bend forward like you're gonna touch your toes. You can get a side view here, Alex, it's fine. Okay, and come back up. How's that feel there, any pain? Yeah, where do you feel it? Middle, left, middle, low back? Okay, and then how about if we try to lean backwards?
My neck.
You feel it more in the neck?
Right there.
Okay, come back up neutral. And then how about if we go side bend, and this one you wanna get straight? Okay, and then left side on that one?
Yeah.
Okay.
Yeah.
Okay, and then how about if we try to rotate our body?
Pulling in my right hip and glutes down my leg.
Okay.
And my left front of my leg. My hips are really sore.
Okay.
And there again, in my left shoulder blade and upper middle back. And my right hip.
Okay, so I want you to go ahead and keep this leg straight and try to push up towards the ceiling. Push up, okay, about a 4 out of 5 there. We're gonna bring your leg out now. Okay, from here, you're gonna push up that direction. You feel pain there? Into the hip. Okay, so just do the best you can. Push up this way, push up. Okay, good. And you have pain in the hip there?
Yeah, right there.
Okay. So right side. Quad, 4 out of 5, psoas, 4 out of 5, but pain in right hip when the psoas test. Okay. And then we're gonna have your leg go like this. You're gonna push up and out, push up and out. Okay, good. Push this leg straight up, push up. So a little weaker on the left side. And then right here, push up in this direction. Go ahead and push up. A little weaker on the left side. Both psoas and quad, 3 out of 5 on the left side. It definitely has a little bit more bow on the left leg here. This hip doesn't want to turn at all. All right, so what we're looking at is how much movement we have in the hip joint. And so we're using the long lever through the foot. So here you're creating an internal rotation at the hip, an external rotation at the SI joint. And so you see how much the foot can go in. And then on this side, as soon as I go to turn, I'm locked out almost at a neutral versus that. So in our assessment, we determined that the left hip that had a lot of limitation moving into the left posterior fibula. He's had cancer, he's had stroke, he's had gallbladder surgery. He's really experienced a lot of life, and also a 33-year sun dancer. And so we want to take as good care of him as possible, like we do everybody here, but I look forward to bringing you into somebody that has some real things going on, and most people wouldn't even want to touch him because he's had his neck broke a few times. They're recommending a surgery where they would go in through the neck, the throat, to help repair C1, C2. And we're going to do this the nature way, hands-on healing. So he does have a big restriction in the SI joint as well on the left side, sacrum, and it's an anterior femoral head. And so I want to adjust that sacrum. I'm going to go ahead and put him in side posture. So Bob, you're going to go ahead and go this side up on your side, and you're going to face me, okay? So the way that we adjust, you know, with Kairos training culture and as we flow into the Source Chiropractic, is to be as honoring to systems as possible. Now, it may look fast, it may look powerful, it may look strong, but there's a lot of timing there, and there's a lot of listening of, is this open to being adjusted, and where, and how? And so, yes, we feel fixation along the SI joint. I feel the sacrum that's stuck. And where does it want to go? How does it want to move? In relationship to what? So right there, take a breath for me. Let it out. Got it. And when you're ready, you'll go back face down. Whew. So I always listen and feel how things are moving. And it'll give us insight on how long has it been stuck? What's it going to take like to get that moving again? This has been stuck a long time, not a large cavitation. So we just starting the journey. And that's the benefit of being able to adjust somebody multiple times a day. I first started doing healing immersions back, I believe it was 2019. YouTube started getting really popular. Had people that wanted to fly in and see me. And how do I get somebody results that I would usually see in 6 months in a shorter time frame? And it's seeing people multiple times a day. And believe it or not, it's not just super effective. It's actually very honoring too. It's just condensed. Most people get care out of convenience. And sometimes it's not the convenience that's needed for your healing. All right, so we're going to continue that sacrum movement with the drop table now. Good work. And just so grateful that, you know, Bob was able to make the journey out to see us too. He lives in California, in Pescadero, on the coast. And he was willing to make the travel to come see us here in Tucson. All right, how are we feeling, Bob? You feel that, huh? So the continuation of that sacrum is coming up through the L4, L5. Take a breath there. Let it out. Yeah. So now I'm feeling how much that is connected to the hip. So if you can imagine, what's happened is left femoral head anterior, creating a posterior sacrum and compression at the L4, L5. So we've done sacrum L4, L5, but we still got work on this anterior femoral head. So I'm gonna see how it does in traction. And how's it doing traction in relationship to the rest of the system? Not good. It does not like that. Well, how do I know? Because everything else tenses when we put it in traction. So this one, we're probably going to drop A to P when he goes supine, so when he goes face up. He's had a lot of shoulder, arm pain. And so I'm seeing how open the system is here. Good. Starting to open up right there. I got you. There we go. So it's a reactive system because he's still in quite a bit of pain. I got you. Take a breath. Let it out. Create space here. Let this head rock. There it was. That was a huge release. So what it felt like, let's let him rest here for a little bit. Take some nice easy breaths, Bob. What it felt like was all these back of the neck muscles were pulling, dropping the base of the skull down here. And as soon as I went to go provide some tension and decompression, everything relaxed. And so I imagine is the occiput was getting jammed on C1 and C1 on C2 on top of each other. And so we just opened that all up. Let's see. Yes, if you actually look at the back of the neck, you should see the change in skin temperature and tone and color. So it's a little red in there, which would be a return of blood flow to where it is needed. All right, we also had a left posterior fibula. So right there, feel that, Bob? So one of the ways you can adjust it is through here. You got to get a rotation back. There we go. And it's continuation down there. So even lower, another stuck point right there. Got it. You feel that in the hip, in the knee. There we go. Okay, roll over to your back, Bob. All right, so we're gonna check this rotation. Did the exam, that was as far as he could go without having pain, right? So now we're here. Still okay? Much better. Okay, so if we go wide and do both at the same time, there we go. So we're getting much closer to being balanced in the hips already. And what do? We adjusted the SI joint. We adjusted L4, L5. We adjusted the posterior fibula. Now I do want to check the femoral head again. So he does have a lot of tenderness right there. But where's that tenderness coming from, right? So obviously femoral head moving slightly anterior, but why would it pull that way? Well, maybe it's mainly the hip flexor, because we have an attachment right there to the greater trochanter of the femur from the hip flexor. It's also a guarding mechanism, but I feel that right there. So we're going to be tender or gentle. So this is actually an energetic portal. So there's a lot of things we can work in this chiropractic field. We can work, obviously, connection to the bones in relationship to the nerve system and how those nerves exit. You can work where the fascia is bunched up or where the muscles have some layer of derangement. But it's all energy when you break it down. And so here, you can feel the pulse of the energy. And yes, does it have connection to some of the ligamentous structures, connective tissue of the abdomen, of the organs, of the musculature, but you can tell how it's jumpy. And there's a pulse to that. So then we feel into it, and typically if you're feeling that, it's not integrated with the rest of the system. So then you can always ask deeper questions. Well, why? Is it scared? Is it a different frequency? Is it not harmonic? Is it not integrated? Is it in protection? Is it in fear? And then, you know, as you, the healing facilitator, the chiropractor, as you begin to embody the tone of love, that is the greatest energetic vibration of healing. So you could really just simply be love and allow a lot to fix itself. But when you have more insight, it is helpful. So what's this need? This needs connection. This needs to know that's going to be okay. And then it's allowed to relax. So look at that passive rotation, beautiful. We did that lift at the occiput C1, C2. That's probably the best rotation I've seen you with, Bob.
It feels better.
Feels better, huh? So what I'd like to do actually is put them in a chair and see how we're doing in a chair. So come on up with me, Bob. You ready? 3, 2, and 1. Do you need your glasses back?
Oh, well, I don't need to see that.
Okay, come on over here with me. Let me sit in this chair. And so for some of you, it's your first time seeing me in a boot. I had a full Achilles tendon rupture just about a month ago. And so that's what's going on with me. But I'm healing it naturally. No pain meds, no drugs, no surgery. we're gonna be good. All right, let your head tilt over this way. Good. And that way. Let me see the tone of the neck. Definitely higher tone on the neck going right there. You can see the squints, which is part, let's see, part of the SCM. It's fired up. So just breathe there. Let it go. And breathe. And go. And back to the center. And then turn your head to the right side. Turn your head to the left. Good. And then straight. And then tilt your head over to the right side, so ear to shoulder. Okay, right there. Another way. This is already looking a lot better, huh? Not too bad. Okay, and straight. You feel it in the shoulder there too. So for today, I feel good with what we've done with the neck. I want to release this. So let's go back to the table one more time.
That would be great.
I got you. So scoot a little bit down towards your feet, Bob. You scoot down the table. There we go, just like that. And you're gonna bring your arm here. How are you there? Is that okay? Not too bad?
All right.
So then I'm gonna connect right to that area. It's the T3, T4, thoracic into the rib, and it's connected to the neck. So I wanna see what neck position helps the most. Turn your head to the left. And that creates some good space. And then find the easiest position that you can have. So maybe a little bit less rotation. Right there. Take a big breath for me. Let it out. Oh. I got you. Let the arm come out. Arm come out. Arm come out. We just adjusted through the entire shoulder capsule. You're just gonna breathe.
The shoulder blade feels better, but the shoulder itself is sore.
Mm-hmm. So as the shoulder blade, inside the shoulder blade released, because it had some connections that were stuck, connected to the spine, he felt what's going on in the shoulder.
Oh, yeah.
And so one of my mentors used to say, you know, when you step on the cat's tail, it's not the tail that yells out, meow, it's the mouth, right? So usually where the pain's at is not always where the problem's at.
I see.
And as we work with people, we're really unwinding patterns. And the most dominant pain will often steal your attention, your focus. Yeah. And as we release patterns, it will shift. And so movement and shifting is a good thing. And so now we're realizing, yeah, there's a lot of inflammation in that shoulder capsule. So what do we need to do for that? And why was the shoulder capsule inflamed? Probably because it was stuck in an anterior position because of the shoulder blade and rib cage being stuck. So we helped one, and then we'll continue to work the other.
Sure.
Okay. Wash day. I'm gonna move your arm. Right there. I got you. Breathe. So I'm feeling where it's sticking. It is at the capsule of the shoulder. Got it. So if you rewind that one back, you'll see I use a distal connect to whip into the shoulder to get the release. So now watch this. Right there. Okay. So that's going to be sore because he's still inflamed. Breathe. Bring your neck here to peace. Go and bring your arm here. So what we had, right, on his right side was a slightly weak scapula causing anterior shoulder, which pulls the ribs back, right? We released that, and then we got to see how much inflammation was in the shoulder. Now, as we release that, we might actually be able to go back to the cervical. All right, so is there something in the shoulder, cervical that's appearing now that we've cleared the shoulder? Yes. And so I've adjusted Bob before. That was the first time I got that to fully cavitate and release. So as I continue work with Bob, we're going to see, you know, when the neck's been stressed out a lot, it can cause a lot of stress in the TMJ. You know, he previously had jaw surgery and teeth surgery, so I'll begin to work a lot in here. You'd be surprised how much of our jaw issues will create neck issues, and vice versa. And so I'm doing just a last check, just a tensioning check. And that's actually pretty good flow through the spine. Traps feel good. You know, he's gonna need some work here, so I'll continue to work with him on this area. There's definitely some guarding of the muscle pattern from having a super inflamed shoulder. Continuing to do some jaw work. But like I said, we're doing a healing immersion with Bob here. I'm really excited for him. Should be able to get 16 adjustments in these next 4 days. And we'll keep you updated, and I look forward to showing you the end result and what that means to his life and what that means to his function. Until next time, peace.